Okay, well, I have 1:15 straight up, so we will go ahead and get going and welcome everybody to our weekly news briefing about COVID-19 in the city of Bloomington County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We will begin, as always, with opening statements. We'll take media questions afterwards. We will begin with Mayor John Hamilton.
Thanks a lot, and good afternoon, everyone. Just my quick city stats. We actually this week, just yesterday, reported 20 employees with a positive case. That's the highest 1 week total ever. That brings our month to 34 already, highest month. So we're definitely seeing real rises in cases in our own workforce. We are going to continue our efforts to ensure our employees are vaccinated or tested. We have the most recent number of 61% fully vaccinated of our full-time employees that we can tell from that. Also, just quickly, the CBU, the Utilities Department, in their stormwater testing, in their sewer testing, had non-detect levels and 100 at Blucher and 120 at Dillman. Those are quite low compared to the past. And I have to remind us, maybe a little more technical than we want to get into, but when we have significant rain, even though the sewers are the sewer lines, rain events do cause infiltration, inflow in sewers. So that dilution, we think, is probably likely to the cause of those lower numbers. So we have to pay attention to the weather in reviewing those numbers too. Overall, of course, the numbers, the cases, the positivity rates are skyrocketing locally and across the state with Omicron. And we're very concerned about that. We are now a red county on the state map, virtually the entire map that way. We have tough weeks ahead. We will continue in our workforce to continue to focus on vaccinations and testing regimes. I know there's been some legal changes at the national level, but we're going to continue to explore all the best ways we can to keep everybody safe. We know that the vaccinated and the boosted are much safer in the midst of this skyrocketing numbers. Everybody should mask, particularly in the weeks ahead. Don't share air if you don't have to. We're rethinking plans as we go. The Martin Luther King ceremony Monday night at the bus, Kirk, is going to be very distanced. There have been changes in the protocols and the attendees and others. We encourage folks to attend remotely for that and many other places. And just a reminder, particularly over the next few weeks, let's try to be very attentive and protective of each other, kind to each other. I'll lastly make a note that we put up some signs at the Twin Lakes Rec Center and at the Frank Southern Ice rink that said, "You must be masked and please be kind to each other and to our employees." We actually found a very good response to that, both in the masking and trying to encourage civility and friendliness in the midst of these challenges. And I hope perhaps we all can look at these next few weeks as a special time to be supportive, friendly, helpful to get through this. And I'm happy to take questions afterwards. And thanks so much for all who are doing so much to keep everybody safe.
Okay, thank you, Mr. Mayor. Let's go to the Monroe County Department of Health and Penny Caudill.
Good afternoon. I put a couple of links in the chat and I'll mention those in just a moment. So I will start with news I don't think is new to anybody, and that's that the county advisory is red this week. Our current rolling daily average is rising every day. It's now over 300 per day, the highest number that we've seen so far. This week, we topped 1,000 cases per 100,000 residents and a positivity rate over 19%. With this amount of transmission, testing sites are understandably overwhelmed. Turnaround time is increasing for those test results. So again, patience is desperately needed, even though it is a very frustrating time if you're looking for testing or waiting for your results. In terms of the Indiana Department of Health and Gravity testing site, they have put in efficiencies. It seems to be moving much more smoothly now that they're using the QR code system once you're in line, those kinds of things. But they had to close early a couple of days this week just because of volume. That by 2 o'clock, they had to stop the line so that they could make sure that they saw all of those people who were already in line. So in other words, come 2 o'clock, they had more people in line than they could see for the rest of the day. Yesterday, they did also close early, but that was more of a staffing issue, as we know that businesses with this level of transmission, staffing is hard in every arena. We are continuing to request mobile units from the state, and they have put a couple of extra units in circulation. So we are waiting on confirmation on one upcoming, and we will share that as soon as we have confirmation about that clinic. The Indianapolis Motor Speedway has been extended through the 22nd of this month, and the state has added some specific walk-in hours for those clinics. Maintaining our prevention strategies is vital at this time, and stepping them up is also a vital step that we can take. Improve your mask wearing. Remember that the best mask is only as good as how you wear it. So if it's on your chin, it won't matter that it's an N95 if it's not worn correctly. Limit your time around others in crowded places, especially indoors. Stay home if you're sick. Follow guidance in terms of isolation and quarantine if you're exposed. Though cases have been in fully vaccinated individuals, we talked about breakthrough cases, have increased significantly over the past month. Hospitalizations and death remain much lower than in those who are unvaccinated. In fact, breakthrough infections, while they do occur, are only 3.7% of the people who are fully vaccinated are experiencing breakthrough infection. And of those people who do get infected, less than 1% is requiring hospitalization and more serious disease care. What I did put, the link I put in, there are 2 treatment maps now available. The Indiana Department of Health has one, the CDC has one. So if you might be eligible for treatment and you're in need of that, then there are links to help you find where you might be able to get that treatment. Vaccine is still available, whether you need your initial series, your 3rd dose because you're immunocompromised, whether you're ready for your booster dose, it is still your best protection, especially from severe illness and death. It's not too late to get your vaccine. Our nurses and volunteers are finishing up our 2nd dose school clinics next week. And since the 12 to 17-year-olds may be eligible for their booster doses now, we have scheduled a school booster clinic for January 29th, and I will share that. I have a flyer for you. Let me share that really quickly. All right, are you seeing it? I know last time I was talking and you couldn't see it.
We see it.
All right, very good. So we have this clinic scheduled. So for students and staff who are 12 or older and are eligible, then they can pre-register and come to this clinic. We do ask people to pre-register if they can, because that helps us plan more appropriately, and it also helps the day and the system run more.
Penny, let me you shrink the size on that PDF a little bit of that, zoom it down so we can see the whole thing.
Gotcha. There you go. How's that?
Go. Yeah, good.
Thank you very much. I appreciate it. We will continue to assess the demand and the need for these clinics, and we will schedule more as is necessary. So we encourage, we've shared this with the schools so that they can get this out to their constituents as well. And influenza is also here. Influenza activity is high. Indiana has already had 5 influenza-related deaths. And just want to remind people that all of the measures that we talk about taking, getting your flu vaccine, getting your COVID vaccine for COVID, masking, washing your hands, all those things prevent and reduce the spread of these respiratory infections. The other thing that I wanted to mention today is that we've received some questions about the new CDC guidance and protocols for the 5 days that that lesser restriction in schools and businesses. So that while these new guidelines do reduce the isolation and quarantine time, it does not mean that schools or a business must implement that shorter time frame, certainly not right away. Many are choosing to wait and not move to the shorter times just yet, and that's okay. And I mention this because we all need to be aware that you might get clearance from your provider that's based on new guidance, but it may not yet be approved by your workplace or your school. So just wanted to bring that up since we've been getting questions about that. And if you are looking for a vaccine or a test and you're having trouble finding one in Monroe County or wherever you might live, I would say broaden your search, look for counties around you. Not every clinic, not every county is experiencing the high demand for testing and vaccine that we are. So feel free to expand that if you have the means to go elsewhere. It's been said that one thing that never changes is that things always change. And we are in a new phase that is, again, different from the past, and it's still evolving. And the last thing that I will say is I'm going to steal some words from others. You will be exposed and you will likely become infected if you are not vaccinated. For those who are up to date on their vaccination, you will be exposed. You may become infected, but your chances of severe disease and death will be greatly diminished because of your vaccine. Back to you, Chuck.
Okay. In lieu of an update from the Monroe County Board of Commissioners, they did want to pass along that there is a blood drive on January 31st from 10 to 3 and February 1st from 1 to 6 at Ivy Tech Bloomington. You can register at redcross.org, and you can also look for dates there as well. Mayor Hamilton notes that there is also one at City Hall every Wednesday from 9 to 3 p.m. Registration again at the Red Cross website. Let's next go to IU Health and Brian Shockney.
Thank you, Chuck. Hello, everyone, and thank you for being present, for always being present, as it demonstrates your support for the importance of the work we're doing and sharing the information. I know I appreciate you, the press, and putting that out for our communities to read, and it's keeping our communities safe. As Penny shared, our number of overall cases in the greater community is the highest we've seen pandemic to date. Yet we are fortunate to see a slight decline here in the South Central region in our inpatient numbers this last week. Our inpatient census still remains at its highest. Part of this is due to incredibly ill patients who they're in the hospital for long enough, but they no longer are considered active COVID based on quarantine guidelines. So we either move them or they're taken out of that COVID-19 status, but they still require that inpatient care. Across the IU Health system, we are experiencing the largest COVID-19 inpatient census than we've seen since the beginning of the pandemic, with an alarming increase of new admissions, as you can see on the screen. As our weekly infographic continues to show, this remains a fight of the unvaccinated, as here in the South Central region, our COVID-19 inpatients are comprised of 80% of unvaccinated individuals, and 90% of those in critical care or on a ventilator are unvaccinated. Nearly 2 years into this pandemic, IU Health as a system, we're on track to experience a record amount of COVID-19 inpatient deaths this month, and quite possibly the same as a state. As a state, over 19,319 individuals have passed away, which is 94% of those deaths that were individuals who were not fully vaccinated. Indiana hospitals have had over 108,782 individuals, last checked on the website, requiring hospitalization due to COVID since the pandemic began. Non-vaccinated individuals make up about 98% of those that have been hospitalized, and we're seeing that here in the South Central region. Another concern across our system and region, as with many industries and businesses right now, are the alarming amount of our team members currently in quarantine. due to COVID or COVID symptoms. It was 94 on the infographic in the South Central region on Thursday, but today it's again over 100 team members, has continued to average over 100 team members for the past couple of weeks. So this large number of team members who aren't able to work make it even more challenging for us to care for the record number of patients. We are very thankful to our support team members who are picking up extra shifts, many working in areas they typically have never worked to help staffing levels and care for our patients and facilities. So please help our teams during this time by getting vaccinated, getting boosted, wearing masks, social distancing, quarantining when sick, and practicing good hand hygiene. And as I close my comments, I want to recognize this coming Monday, we will be celebrating a national holiday, Martin Luther King Jr. Day, a day when we celebrate Dr. King's contributions to the progress made in all things that were part of his dream. And yet there is so much more to do for ensuring this dream is fulfilled, that we treat every human with dignity and respect. In light of this pandemic and support of our healthcare heroes, I would ask that when you or your loved ones seek health services, that you give grace, you show respect, and you understand the difficult circumstances we face 24/7, 365. My favorite quote from Dr. King hangs on my office wall, and it says, "We must learn to live together as brothers or perish together as fools." If nothing else, this pandemic has demonstrated our need to be together and heed these important words now and in the future. I appreciate all of you, and I'm happy to take questions at the end.
Okay, thanks very much, Brian. We'll next go to Indiana University. First, Aaron Carroll, then Kirk White.
Well, as everyone has been saying, and I'm not going to belabor the point too much, this is a surge. This is about as bad as we've seen it in terms of numbers, and I'd say that we're experiencing a similar situation at IU, where the numbers are higher than we have seen before. Having said that, they're about, well, in fact, they're probably a little bit lower than I think I might have even expected this week. We are encouraging vaccination and booster, which is the best thing we can do, as many of others have said, in order to keep people both from getting ill and keeping this as contained as possible. We have drop-off testing on top of our symptomatic testing, on top of our voluntary testing, on top of our COVID check testing. And so there's just an enormous capacity to make sure that those who get tests can get them. We've revised our quarantine and isolation guidelines to more closely match those of the CDC. And we are optimizing all of our procedures to keep all that going. We have asked faculty not even to unmask while they're lecturing, to keep our classrooms as safe as possible. And as we've seen throughout the pandemic, our classrooms tend to be some of the safest places that we have on campus, with very, 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 very few documented transmissions that take place there. All of which is to say that we're doing our best to be as safe as possible while this surge is still going on. We're optimistic that hopefully, as it is in many other places, this surge will start to decrease in the next, hopefully, week or two. But regardless, we will keep all of our safety measures in place, everything else that we're doing to try to keep Indiana safe, or keep IU as safe as possible, which we hope also keeps Bloomington and Indiana as safe as possible as well. Then I'm happy to take questions when we're all done.
Thank you, Dr. Carroll. Just to review the numbers that Dr. Carroll was discussing there, this week, we're up to 544 cases on the Bloomington campus. 437 of those are students, and 107 are faculty and staff. That's up from 260 last week. So you can see it's doubled, which is pretty much what we were preparing for. But frankly, things are going a little better than we might have expected in some respects. Our vaccination rate staying steady at 95%. And we believe that that's one of the reasons for our ability to continuing operations as we have. As Dr. Carroll mentioned, we've got significant testing options. I'll give you the link there. I want to highlight, of course, we're continuing with our asymptomatic testing, voluntary testing. If you believe that you've been exposed, That's still available. If you are feeling symptoms, we have symptomatic testing. And the new part about that is that we wanted to make sure we had plenty of capacity. And so to make that easier, we've brought on a new drop-off testing option. And you can pick up these testing kits at the health center or at East Garage on Jordan. And then what you do is put your saliva sample in the kit, link it to your IU account, and put it back in a separate collection box. And we'll get you back those results within 24 to 72 hours. It takes a little longer over the weekend. However, our labs will be operating next Monday during the holiday to get us through this surge. So we have that new option, and that's been accepted very well. People are starting to use that this week. And yes, of course, our mitigation testing for those unvaccinated that have exemptions, that continues, and they're getting tested on a weekly basis. We've also wanted to keep an eye on contingency plans and continuing operations on the campus. I'm pleased to report that we really are been able to get by this week with few disruptions. Some of our dining facilities have had to curtail operations. We've consolidated some due to lack of staff, but there are still plenty of dining options. We've added some new grab and go options to help us through this time. But our bus service is running with all of its schedules and staffing. And overall, support-wise, we've been able to get through this week as well as we can. What we're seeing is where we, in various departments, it's you may have 5 people out this week. They get well in 5 days with the new CDC guidance, and they're back. And then the next 5 are out for a while. So it's kind of a rotating thing. I imagine President Shockney is seeing the same thing at the hospital, but that's how we've been able to continue operation. So with that, I'm ready to take any questions.
Okay, we will go to questions, and I'll direct this one to Penny from Brock Turner, WFIU, WTIU. And Penny has said that she's lost video, so this will be an audio-only answer. What options do business owners have if they want to encourage employees to get vaccinated? Well, Penny, we're not hearing you. You may have lost audio as well. So, well, why don't we come back to that one, unless someone else has something they want to throw in on that answer. We'll come back, and Penny's disappeared, so she'll come back in. I'll redirect that. This question from B Square Bulletin from Mayor Hamilton: what can you tell us at this point about the impact of the Supreme Court decision yesterday on the city's vax or test policy? Will the city continue to enforce that policy? If the city is not going to enforce the policy, doesn't that make moot the lawsuit brought by the 3 city unions? And what's the latest update you can give on that?
Thanks for the question, and I'll just comment very briefly on the prior question too. Of course, private employers are free to provide, there's Penny Caudill back, so she can probably add all that. We'll get back to her on that. But private employers have wide variety of things they can do, many of which are being done by employers on this call and others, to encourage vaccinations, sponsor them, require them, incentivize them. There's a myriad of options to undertake, and we thank those businesses that are really helping do that, and institutions like IU too. On the Supreme Court decision, look, I'm very disappointed in the Supreme Court decision. I think it's unfortunate. A court that has changed in many ways has limited the ability of an agency to try to protect Americans at the workplace, but that is what it is. You might guess that my lawyers are always wanting to be careful about what we say in the middle of a lawsuit, so I will be a little bit circumspect about that. We have been sued about the procedure, but the city, before the OSHA rules and amid the OSHA rules, and now with those part of those ruled by the Supreme Court not to be applicable, we continue to believe how important it is, based on the science and the recommendations, how important it is that our workplace be as vaccinated as we can, and that we take steps to protect everybody. As I noted at the beginning, we've had more positive cases from our workforce this month than ever. This week was the highest week reported total ever. We are committed to continuing to provide public services, from public safety to water to sanitation to all the work that we do to help our community get ready for storms and other things like that. So we have not instructed any change to our cabinet department heads at this point. We will be reviewing options, but I will just say, as an employer and as responsible to try to provide the services that are so important for our city, we continue to focus on how to assure our workplace is as safe as we can make it. So we're sorry the OSHA rule decision came out that way, but we're going to continue to be focused on how to keep everybody as safe as we can. No order change at this moment. We're reviewing our options, and we'll keep you posted on that.
Okay, with Penny visually back, and I assume we can hear her as well. Again, the question was, what options do business owners have if they want to encourage employees to get vaccinated?
Sure. Well, part of that is probably a legal question that I'm not equipped to answer, other than I know when I got back on, the mayor was talking incentives. I think that doing everything you can to encourage and incentivize your employees at this point is something that you can do. And you can think outside the box, figure out what works for your business and your employees. I would also hope that employees will think about their workplace and wanting it to be as safe as it can be for them and for those that they're working around, and that they would want to be vaccinated.
Back to Mayor Hamilton, there was another part of Dave Askin's question that I missed here. What have department heads been told about enforcing mask wearing for vaccinated versus unvaccinated? Oh, you're muted. Still muted.
Sorry about that. I apologize.
Okay.
We have the same rules essentially for masking vaccinated or unvaccinated at the moment, just to try to keep everybody safe, as far as I know. Yeah, sorry. So we're very intent on encouraging mask wearing and trying to provide masks as we can, and procuring masks and all that stuff.
Okay. Question for Brian Shockney from Jeremy Hogan at the Bloomingtonian. He's asking, he says he's hearing or asking if IU Health is using conference rooms for patients. I'm hearing that some IU Health facilities are using conference rooms for patients because they are already out of space, but not sure if that's happening here in Bloomington.
So that is not happening here in Bloomington, but it is happening in other locations, not just at IU Health, but other healthcare facilities. We're using every opportunity. Those spaces, though, are being utilized for mostly triage, expanding emergency departments, expanding areas where we can hold patients who are ready for discharge, those types of things. Patients who require a bed are getting a bed, and then we utilize those spaces for testing and holding patients and those kinds of things. But we are having to use non-traditional care spaces to care for patients, and we are having to use every square inch of our buildings to be able to care for patients during this surge. Yes.
Question from Patrick McGurr at the Herald Times for Mayor Hamilton. Given staffing constraints at the fire, police, and transit departments, how are COVID infections among city staff affecting bus service and public safety? What share of police officers is fully vaccinated and boosted, and what share of firefighters?
Thanks for the question. I think like any employer, we have staff constraints facing us across the board. We're managing those regularly. Just as an example, I was talking to director of the Bloomington Transit a Caudill, John Caudill, and they are dealing with scheduling and adding some longer schedule shifts for bus drivers to try to build a little capacity into the system for the inevitable absences that come. We have been able to keep that service going. Similarly, in public safety and other facilities, I was talking to Public Works Director Adam Wason, and they're trying to make sure we have backup commercial driver license CDL drivers available in case of need for keeping our streets safe and passable for all, including emergency vehicles if we have weather and that kind of thing. So there's a lot of planning. There's a continuity of city government team that's meeting regularly, continuing to meet, that explores, identifies risks and such, and we continue to address that, which is not to say services may not be interrupted some, pressured some, as they have been in many places, but we're doing our best. The question about the share of each department being vaccinated and boosted, we actually, I've shared the overall amount of city employees. I can tell you that the departments range from about 50% to 100%, but we do not release individual departments, partly out of privacy of individuals in those departments. We continue to encourage everybody to get vaccinated and have our incentive program still, but we don't release that as public information just to protect some of the privacy of those department members.
Okay. No other questions this moment. I'll give a moment for some more questions if there are some. I actually just got one from Brock Turner. So the last 2 weeks, the city has reported the highest numbers of COVID positive employees ever. How does the city prevent cases from spreading among each other? Mayor Hamilton?
Well, sure. We do all that we can. All the evidence that we've gotten is that the vast majority of our cases are happening not through transmission at the workplace, but rather through other contacts, social, family, et cetera. That continues to be the case. It's been the case that the workplace is a relatively safe place to be in terms of transmission to each other. We have distancing requirements. We have masking requirements for all of our employees, including me. I'm only unmasked because I'm behind a closed door in my office. And when we have any interactions separate from that, we're masked. So it appears, that there's very little transmission happening at the workplace. And so these measures will be continued and we'll continue to watch that. But the community spread is hitting all of our employees just like it's hitting everybody else in the community.
Okay. We'll give a moment more for any other questions we have here. Remind you on the IU end that you can find information on IU's policies and the latest information on COVID at covid.iu.edu. And a brand spanking new Ask Aaron session is now archived and linked to from that page, which has some excellent information from this week about the latest surge with our own Aaron Carroll. So if you want to hear more from him, that is up on the website, either at broadcast.iu.edu, or you can find a link on our covid.iu.edu page. So seeing no other questions, we will leave it there. We will plan to be back again next week, 1:15, for our regular briefing. We will see you at that time.
Thank you all.